Today I will be doing an assessment on the gastrointestinal system, the urinary system, and then I will film a video after on how to do a self-breast and testicular exam. So the first thing that I'll start with doing is she's in a good position that I can view her abdomen. I can see that her abdomen is nice and flat, it's not distended. I don't see any kind of palpitations, so that would be present if there was some kind of aortic palpitation, which she does not have. Oftentimes this is found on very skinny people. And so the next thing that I'll do is I'm going to go ahead and auscultate her bowel sounds in all 4 quadrants. So she has normal active bowel sounds. The next thing that I'll do is I'll use the bell on my stethoscope and I'll listen for bruits over her iliac artery, her renal artery, her femoral artery, and in the aorta to see if she has any abdominal aortic bruits. So starting with the aorta, the abdominal aorta, I do not hear any bruits there. And then the next place that I'll listen for is in the kidneys. So the kidneys are right over here on the edge, towards the back. Do not hear any there either. And then I'll also find her iliac crest, which is right on the edge of her hip. And there's no bruise present there either. And then her femoral pulse or femoral artery is right here, and I'll listen there as well. And I don't hear any bruise there either, so that's normal. The next thing that I will do is percuss her abdomen. So I'm just going to do a general percussion around. So I can hear as I move down her abdomen it becomes more dull towards the beginning or the top of her upper quadrants are more tympanic sounding, which is normal. So I'm going to start with doing some light palpitation. So just feeling for tenderness. And I can see by looking at her face that there does not be any, no guarding or tenderness. Are any of those areas tender when I palpate them?
No.
Okay, so now I'm just going to go in and do some deeper palpation, which I do not feel any nodules or masses, so that's good. So then the next thing that I will do is I'm going to palpate and percuss over her kidneys. So on this side, so she doesn't have any tenderness there, and then I'm going to percuss, and I can hear that it's dull. And then I'm going to search for her, the edge of her liver, her lower liver. So I'll just start right under her rib cage, and the liver lies underneath that, so I'll just do deep palpation to see if I can feel that. And I don't feel her liver, which can just tell you that it's not enlarged. And I'm going to do the same over on the other end for her spleen. And her spleen lies right on her left side underneath her rib cage as well. And I don't feel that either, and I'll percuss over that area. And it's dull as well. So starting on the liver side over here, I'm going to just start at the edge, mid-sternal over to mid-clavicular, and try to find the edges of the liver to see if there's any enlargement. So that's one end here. So that's about 6 centimeters, so that's within normal limits, so there's no enlargement that I see. So she doesn't have any liver enlargement.
I'm going to begin with talking about how to do a self-breast exam. So the best time to do a self-breast exam is 5 to 7 days after onset of menses. And you want to start by inspecting the breasts. So you want to stand in front of a full-length mirror with your arms at the side, and you want to just look at the appearance of the skin. If the breasts are symmetrical, if you notice any nodules or dimpling in that position, you want to look at the characteristics of the nipples, you want to look at the contour of the breasts. And then you're going to go into 4 different positions when doing a self-breast exam. So the 4 different positions include leaning forward with your hands on your hips, standing upright with hands on hips and behind your head, And then you also want to stand with your arms at your sides laterally. And in each one of these positions, you're going to inspect for changes in the appearance of your breasts, as well as any dimpling in the positions. So you're going to inspect first, and you're going to inspect the breasts for any kind of bilateral pull in all these positions, the symmetry, the contour, the different color of the vascularity, as well as surface characteristics. And the next thing you're going to look at is the areolas. And you're going to identify the color and the surface characteristics. You want to look and see if they're symmetrical, if the color is even, and what the surface looks like. Then you'll move on to looking at the nipples, and you're going to look for the position, if they're symmetrical, if they have any surface characteristics, if there's any lesions, bleeding, any discharge. And then you're going to just palpate your breasts, and you're going to check for any kind of heat, tenderness, pain, if there's lesions or nodules or masses, if there's any thickening around nodules, if there is any. And then the last thing that you will do is you're going to palpate the nipple for any nipple discharge. And as well, you should inspect your axillary for any color or rash or lesions that might radiate from your breasts. So the next thing that I want to talk about was a testicular self-exam. So men should typically be checking themselves monthly. They should stand in front of a mirror after a warm bath or a shower. This tends to relax the scrotum. And they want to just inspect the scrotum for any swelling, redness, any lesions, any noticeable nodules. They also want to palpate each testicle, and they do this by taking the index and middle finger underneath the testicle and use the thumb on top and just kind of gently roll it in between to feel for the size, the shape, contour, swelling, symmetry, any tenderness, any lesions, any